Hi, my name is Grace, and I'm your nurse for today. And today I'm going to teach you a little bit about the different antipsychotic medications. And there are two classes that we're going to discuss today. One is called first generation antipsychotics, also known as typical or conventional, and the other is called second generation antipsychotics, also known as atypical. Both of these medications start with a low dose, they're gradually increased, and then they will be slowly tapered off. We're going to start with the first generation antipsychotics, and these work by blocking dopamine receptors, therefore decreasing the amount of dopamine in the brain. And dopamine is thought to be implicated in psychosis. These medications within the first generation class, these treat the positive symptoms. Think of positive symptoms as things that are present that should not be, like these are added. These include things like hallucinations. Most common are like seeing or hearing things that aren't actually present in reality. Then there are delusions, which are false fixed beliefs. And disordered thought and speech processes fall into that category as well. Side effects include sedation, weight gain, orthostatic hypotension, which with that side effect you're going to change positions slowly and ensure hydration, sexual dysfunction, blurry vision and dry eye, and you can wear sunglasses and use artificial tears to help with that, urinary retention, and constipation, and to help with that, fluids, fiber, and activity can help relieve constipation. Dry mouth, so you're going to want to sip water or chew sugarless gum or suck on sugarless candy. And then there's extrapyramidal side effects, also called EPS for short. And there are multiple side effects that fall under this category, and it's all involving like movements, whether it's restlessness, being unable to sit still, painful muscle freezing, you could have a shuffling gait or tremors. And there's even an irreversible side effect that falls in this category that pertains to involuntary body movements. And we will be screening for these, and if you notice any movements, you're going to want to call your healthcare provider because we can then prescribe medications to help reduce it. Alright, so now we're going to move on to second generation antipsychotics. And these work by blocking both dopamine and serotonin receptors in the brain. So we're going to be decreasing both of these amounts. The medications that fall within this category treat the positive and negative. So the positive symptoms, like I previously explained, are the ones that are added. So negative symptoms are things that are lacking, that should be. Examples include lack of motivation, lack of socializing, lack of expressions. So second generation antipsychotics, these have the same potential side effects as the first generation, but they tend to be fewer and milder, so they're better tolerated. There is a low risk for those EPS or those movement side effects we previously talked about, but there is an additional side effect, and that's the risk for a metabolic syndrome, and that will include weight gain, especially in the abdominal area, insulin resistance, increased cholesterol, and a healthy lifestyle of diet and exercise can help decrease this. Another one to be aware of is agranulocytosis, which is a decreased white blood cell count. And this is a risk for all, but the most significant risk is with clozapine, which is a second generation antipsychotic. And this would be important to maintain lab appointments to monitor your white blood cell count. And this would begin weekly for about 6 months. And you're going to want to report any signs of infection, whether it's a fever, sore throat, or body aches. There are some life-threatening side effects, one of which is neuroleptic malignant syndrome, NMS for short. This occurs more with the first generation antipsychotics, but it can occur with either, and the hallmark sign is a high fever over 103. So it'll be important to call your healthcare provider if you have a fever, or if there's any mental status changes, or you have rigidity of your muscles. Another life-threatening side effect is the anticholinergic toxicity. With this, you're going to want to report any worsening of psychosis, hot and dry skin. Another thing that could occur is liver impairment because the liver is what breaks down these drugs. And if you have any yellowing of the skin, the eyes, dark urine, pale stool, please report these to your provider as well so they can initiate treatment. Now, before we go, I'd like to ask you a few questions and have you do a few things for me. Okay. Do you have anything in your mouth, like gum? Okay, if you could just throw that away, please. There's a trash can. Thank you. How is the current condition of your teeth? Do your teeth bother you now? Do you notice any movements in your mouth? Any in your face? How about any movements in your hands or your feet? And how much do these movements currently bother you? Do they interfere with any activities during your day? Okay, now I want you to sit in this chair with your hands on your legs. And your legs can be slightly apart and have your feet flat on the floor, please. Thank you. And now sit with your hands hanging unsupported. Thank you. Now can you open your mouth for me? Okay. And now can you open again? Okay. Now can you please protrude your tongue? Okay. Now protrude your tongue again, please. And I want you to tap your thumb with each finger as rapidly as possible. I'm going to do it with your right hand first, just like this. Okay, thank you. Now can you do it with your left hand, please? Okay, now I'm going to flex and extend your arm, and I'm going to do it with this one first. Now I'll do it with the other one. Can you stand up for me, please? Okay. Now can you extend both arms out in front of you with your palms down? Thank you. Now can you stand up and walk a few paces, turn around, and then we'll come back to the chair. Alright, and can you do that one more time for me, please? Thank you. And that's all I have for you today. Do you have any questions for me before I go? Okay, and I know we covered a lot of information with those medications today, so I'll have all the information printed out for you, and I'll make copies for you and your family so you can be aware of the different antipsychotic medications and the side effects, to what to look for and what to report to the provider. Thank you.